For over 100 years, Mount Auburn Hospital has been an integral member of the greater Cambridge community. Caring staff, committed volunteers, together with others who have donated time, talent, and treasure, have created a first-rate environment for patients and their healthcare providers.
In 1986, I was diagnosed with another hospital as having a heart problem and said there was nothing they could do for me, just medication. My uncle told me that he was going to the Mount Auburn Hospital and he was seeing this Dr. Saul. So I made a change and went over to see Dr. Saul in 1987. I was a pipe fitter by trade, and a pipe fitter back then, I was expected to carry, 10-inch pipe on my shoulder with other pipe fitters and do some heavy lifting and what have you. So I couldn't do any of that. I mean, I couldn't even take the barrels out, let's put it that way. Back in this 87, I was taking like maybe 20, 25 pills a day. I started staying home more and more and watching things on TV. Even sitting on the couch watching TV, I have to take a nitro, and I was at rest. And when I was taking nitros, like they were lifesavers. So at that point, you start hearing the angels calling, and you think it's time. Well, Friday at 5:15, the phone rings, and it's Dr. Saul. Now, when Dr. Saul calls you at 5:15 on a Friday, you know you got a problem. He says, we have to do something immediately. And I said, well, do you want me to try to lose some more weight, do this? He said, no, we have to have an operation. I said, an operation? I said, it's been over 20 years and there's no sign of operations. He says, well, we have a new surgeon, and he had looked at some of the film and said that he could help me. It was kind of a really, touch and go situation because they had said that, if I hadn't went for the operation, I may have not seen Christmas. The Dr. B told me at the beginning, he says, you're going to be 6 months before you really feel good. Well, after 6 months, I felt like a new person. I mean, I was just doing things I haven't done in years. Mount Auburn, first of all, had the only surgeon after 20-something years they could even think of helping me. Mount Auburn is my hospital because Mount Auburn saved my life.
With Dr. Virginia and others, Mount Auburn continues to maintain the highest quality medical staff, just as it had 50 years ago when Mary Simons began volunteering at Mount Auburn.
I myself was a Red Cross nurse's aide during the war, and so I began to think my children were older and perhaps I should volunteer again. And they assigned me to look after the families of Dr. Dwight Harkin when he was doing his open heart surgery. The family had to sit and we walked them around. There was no place to eat. So I began to think a little bit. And eventually they asked me to help develop a coffee shop. I thought that might be a challenge. So the next few years, I ended up going and visiting all the coffee shops in the Boston Hospital area. When they built the new building, in the basement of that building was the new coffee shop. I am pleased to help Mount Auburn in any way that I can, and I'm sure the hospital will continue to help not only me, but the residents of Cambridge and nearby communities.
Having our kids born in the hospital that's closest to our home and in the town in which we live in, or the city in which we live in, is pretty important. There's a connection that it's so close, we can go there. The kids can see where they're born.
I've also had experience with larger hospitals and in the area, and while the expertise may be there, they're so large that you feel like a number, not a person. I think we feel very, very comfortable coming here and knowing that we're going to get an extremely high level of care, but also be treated as an individual.
You have closer access to care, and the nurses are so experienced, and the doctors, they love what they do. So I kind of feel like it's more of a special event, especially having children here, than it is just, oh, this is where you have your baby.
Mount Auburn is our hospital because it's accessible, but also because it provides access to the highest level of care that we could need.
Volunteer nurse and hospital trustee Patsy Conradis makes her contribution to the hospital's mission because she and her whole family believe it's a great medical facility where you get one-on-one attention.
We'd been to major hospitals in Boston and in our previous places we lived, and this had a very good reputation, and it was a couple blocks away. And we had children at home at that time, and so I researched the emergency room. Every time I've been in the hospital, I've gotten tremendous attention. I think the physicians are outstanding. I think the facilities are very good. And I think they're, broadening every day with this new addition, and we're getting better facilities. And I think the nursing staff is really on top. There's a great harmony, and I think people try to cooperate with each other. And I think that's a tremendous attribute that both the nursing staff and the physicians have. And that, to me, makes it very strong that they really cooperate. I'm an RN, and I work in Wyman 4 and pre-care before they go into surgery, and that's been very gratifying. It was a hard concept for hospitals to accept a volunteer nurse, and I was given that opportunity at Mount Auburn. Mount Auburn is my hospital because I have a great respect for their outstanding physicians, the caring nursing staff, and the things they offer for our family.
The Mount Auburn family of caregivers unite with a strong dedication to providing patient-centered care with compassion, privacy, and dignity.
I came to this hospital because it's a city teaching hospital, but it's in a community. And to me, I walked through those doors, and I've been here full-time 25 years later. I've grown here, I feel comfortable here, I feel safe here, and I feel like this is the place I'll probably retire at. I think one of the things that sets it apart is the size of it. It's not so overwhelming, but it's not a tiny hospital, and you just have a better sense of family here. You're not a number. If I meet patients in the elevator that I cared for 20 years ago, and they still remember me. The physician staff, I've worked with a lot of them for the same amount of time, and there's a good feeling in that, where you can go up to a person, you can discuss with a physician an issue, and it's on a personal basis. It's not a stranger I'm talking to, and there's something really, really feels good about that. This is the second building fund I've been through since I've worked here, and I gave for the first one, and it was easy. When I had the conversation with my husband, I said it's not even a question that I would give to this one. I said I look back, my entire career is here, and he absolutely agreed. Mount Auburn is my hospital because it's given me everything I've wanted in my nursing career, in a great environment to work in, and security, and I'm happy to come to work every day and do what I want to do, and that's take care of patients.
Mount Auburn is my hospital.
Mount Auburn is my hospital.
Mount Auburn is our hospital.
Mount Auburn is my hospital.
Mount Auburn is my hospital because Mount Auburn saved my life.